E1 syndrome means bicytopenia, which will be a combination of autoimmune hemolytic anemia and immune thrombocytopenic purpura. This is what we call as E1 syndrome. A 46-year-old man presents with bicytopenia. His platelet count is 5,000, hematocrit is 20%, and a corrected reticulocyte count is 10%, which means you are probably dealing with a hemolytic anemia once again. So you're having a hemolytic anemia based on the reticulocyte count, and LDH concentration is definitely elevated, 3 times the upper limit of normal, which confirms that this patient is having a hemolytic anemia only. Examination reveals a large spleen. So patient is having a splenomegaly, so which suggests that it could be a warm type of autoimmune hemolytic anemia. After 1 week of prednisolone therapy, at 1 milligram per kilogram, there is a rise in both the hematocrit as well as the platelet count. What is the most likely underlying disorder in this patient? So this patient is having a thrombocytopenia, which is very likely to be an immune thrombocytopenic purpura in the background of autoimmune hemolytic anemia. So probably we are dealing with something called as E1 syndrome. So what do you mean by E1 syndrome? E1 syndrome means bicytopenia, which will be a combination of autoimmune hemolytic anemia and immune thrombocytopenic purpura. This is what we call as E1 syndrome. There are primary E1 syndrome, but most common cause of E1 syndrome is secondary causes only, like SLE, and more importantly, conditions like peripheral T-cell lymphoma. This is something that can cause secondary E1 syndrome. Suspect secondary E1 syndrome due to peripheral T-cell lymphoma, especially if you have an E1 syndrome in a patient with a significant splenomegaly. Especially moderate to severe splenomegaly, always think about peripheral T-cell lymphoma as one of the important causes. Autoimmune disease can cause E1 syndrome, but I don't think you will get such a significant splenomegaly in that situation. And especially autoimmune disease causing secondary E1 syndrome commonly happens in a child, okay, not in adults. So the patient in question that we are dealing with is an adult. And mycoplasma infection, on the other hand, tends to produce cold agglutinin disease. They produce cold autoimmune hemolytic anemia. They're not going to produce warm type. And even marginal zone lymphoma, for that matter, is going to produce only cold type of autoimmune hemolytic anemia. That is, cold agglutinin disease and not a warm type like this, or not E1 syndrome. Right answer for this question is going to be peripheral T-cell lymphoma. And remember, peripheral T-cell lymphoma is exquisitely responsive to steroids. They really does respond to steroids, especially the autoimmune component will respond very nicely to steroids.
Subscribe and press the bell icon so you never miss an update from PrepLadder.